So my background is I was a neurotrauma nurse, and my question was, we had patients who were surviving who had not survived in previous decades after traumatic brain injuries. I was wondering where they were going because they began to cut back the amount of neuro-rehab that people could get. It used to be there were long-term neuro-rehab centers, and I was wondering where they were going because we were resuscitating them, they were regaining function, but was it good enough to survive on the streets? Importantly, we used to have mental health hospitals all over the place. We have mental health systems and we have some things, but we don't have those big mental health hospitals that we once had. I've studied 770 roughly inmates. I'm going to be talking to you mostly about the 150 females that I interviewed with at least an hour, some of them more if they wanted to talk more, of private interview with a physical examination. And of those 150, there were, again, minimum and maximum security evenly distributed, and 9 of them committed homicide. I had 12 non-criminal controls in the same setting, so it was employees within the prison setting because I wanted the exposure to the same environment when I was looking at the hormones. And they just cycled downward, spiraled downward. When I saw people coming in and out, then I'd interview them again after they came back from being released and came back. Everything got worse. They went out on the streets. They just got engaged in all kinds of worse things, and it just cycled downward. Unfortunately, the women who were abused in childhood ended up having abuse in adulthood because they gravitated towards what they were familiar with, not necessarily what's best for them. They had a hard time with normal people and having healthy relationships. They didn't know how to do that. But the unhealthy ones, it was like they were trying to fix what they couldn't fix growing up, and they're thinking now subconsciously they're going to fix this one who's abusive because they couldn't fix it growing up, but they're going to eventually fix this one. And they kept getting in abusive relationships. When we take mentally ill people or those with traumatic brain injuries and we house them with hardened criminals, prisons become graduate school of higher crime, and that's their only source of structure when they get out. These are the people they know now. So really problematic. We used to have mental health hospitals where they could go, and people worked hard in the late 1800s to get the money to build them, to turn the prisons into healthcare settings, and we had it all in place in the turn of the century in the early 1900s. And what did we do? We closed them. That was depressing. So I wanted to take you someplace better.